was a discussion about a form of camps on the CDC website. I sent that over to you, Jeffrey, because we've been running around over here. What did you find?
Yeah, it was called Operational Considerations for Implementing the Shielding Approach. That's an interesting word there, to prevent COVID-19 infections in humanitarian settings. Now, this is guidance to, it's called to, quote, highlight potential implementation challenges and to guide thinking. And it says here, the shielding approach aims to reduce the number of severe COVID-19 cases by limiting contact between individuals at higher risk of developing severe disease and the general population, low risk. High risk individuals would be temporarily relocated to safe or green zones. Here we go with the military terms, established at the household, neighborhood, camp sector, or community level, depending on the context and setting. They would have minimal contact with family members and other low-risk residents. So let's take a look at the table here, how they break this down. We have household level, neighborhood level, and camp sector level. Basically, this is all built around movement of individuals inside and outside of this thing called the green zone. And you can see at the camp sector level, there's going to be one entry point used for food exchanges, a general meeting area where people can have visitors. Kind of sounds like a prison. So let's continue into this document. Brilliant stuff. The further quotes, the shielding approach proposes that green zones be maintained until one of the following circumstances arises. Sufficient hospitalization capacity is established, effective vaccine or therapeutic options become widely available, or the COVID-19 epidemic affecting the population subsides. It goes on.
Just look at that line. I mean, when you hear Fauci saying till the end of 2022 is where he sees some sort of imaginary end to this, though the vaccine doesn't seem like it's going to bring it. Are we talking about the potential that some people could be in these internment camps being protected for their health and safety for, I mean, God knows how long? I mean, it's I think a lot of people are probably shocked right now to know that this is not only being thought about, it's written and on the website at the CDC.
Months into the pandemic and with no end in sight, is it time to reevaluate the way we live with COVID-19? Some doctors are now convinced that the lockdown measures meant to protect us from the virus could actually be hurting us. Instead of sheltering all of us, should we just be sheltering some of us? Senior investigative reporter Begat Shaban reports on a controversial approach to fight COVID-19.
Dr. John Ioannidis believes many of our current restrictions are unnecessary and not actually supported by science.
People going to the beach to enjoy nature, something that has practically absolutely no risk.
He's an infectious disease expert and professor of medicine at Stanford.
We know that 95% of the population has practically minimal risk.
Because of that, he believes most indoor facilities can reopen safely, including restaurants, bars, gyms, and even schools. Dr. Ioannidis believes many of our current rules should be lifted.
There can be many negative ramifications and many negative consequences from stay-at-home and lockdown orders. The large majority of the population should be allowed to go back to their lives. So it's unlikely that in the current situation we are really saving lives. I think that probably we're killing people by following some of these measures forever.
Killing people?
I think eventually we do.
Courtney Patel is convinced her husband died because of fears created by the lockdown.
We kissed and to say goodbye, and he said, "I love you," and then he went down.
That morning, her husband Dominic suffered chest pains, but he refused to go to the hospital. Like so many people, he worried about catching the coronavirus.
I do think that messaging, played into that fear and the reluctancy of just, acting on those symptoms sooner and even calling 911 sooner.
By nightfall, Dominic was in serious pain. Against his wishes, his wife called 911. As the EMTs prepared to take him to the hospital, Dominic died of a heart attack at home. He was just 38 years old.
Absolutely, we have seen the negative impact of people being fearful of medical care.
Dr. Chris Colwell is chief of emergency medicine at San Francisco General Hospital.
Have you had patients die that you think likely may have survived had they come here earlier?
Absolutely. Absolutely. And I would say it's not just a few of those. At least every week we are seeing somebody who's going to suffer and is suffering severe consequences from having delayed care for fear of coming to the hospital.
29% of Americans are avoiding or delaying medical care due to fear of catching the coronavirus. That's according to the American College of Emergency Physicians. Dr. Ioannidis argues a more surgical lockdown can protect those who are vulnerable, while still allowing most other people to return to a relatively normal life.
We have to balance everything, and I believe that in the current situation, prolonged lockdowns are going to do enormous harm to health and more.
With the investigative unit, I'm Bigat.